Have you had a C-section? Whether you've had a C-section 6 months ago, 5 years ago, or 20 years ago, you most likely have abdominal scar tissue. Here's the deal. I'm going to tell you exactly why your C-section scar may not be fully healed and the signs and symptoms to look for to determine if your C-section scar is fully healed and what to do about it so you don't end up being bogged down with aches and pains from this scar. If you're struggling with things like hip pain, sciatica, knee pain, or just generalized low back pain, most likely your scar is playing into those pain symptoms. Now, you might go to a regular physical therapy or chiropractic and they work on the area that's hurting and it gets better for a little bit, but then it always comes back. Well, a lot of the reason is because your scar could be impacting your core. Your C-section scar was done on your lower abdomen. When they cut to get the baby out, they go through 7 layers of tissue. These tissues include muscles, fascia, skin, and even all the way down to the uterus itself. Then they stitch you back up and you're healed. Well, not quite exactly healed, right? We have to heal and retrain the body to work for us again. But most people aren't taught exactly how to get rid of the scar tissue and then adequately retrain the core. The reason this is so epically important is because when women end up in their 40s and 50s and they have intense menstrual cramps, heavy bleeding, sciatica, or low back pain, or chronic hip pain, most of the time it's because their core has been shut down ever since they had the C-section and hasn't been working for them because the body has compensated absolutely beautifully. The scar tissue works to provide structure, but what it also doesn't allow is it doesn't allow the muscles and the fascia to contract and relax and move when activity is happening and when we're training the core. So if you've done all the right exercises and you've had all the PT and all the chiropractic and you're still having sciatica and you're still having hip pain and you have a history of a C-section scar, you absolutely need to get that C-section scar moving and also get your pelvic floor moving. So when they cut into the belly and they go through all that tissue, when they stitch you back up and the scar starts to take hold, it tightens down. But that tightening can pull on the fascia from different areas, including from your pelvic area, pulling up and creating tightness of the pelvic floor. When we have tightness of the pelvic floor, we actually get dysfunction and we get weakness because a tight muscle is a very weak muscle. A muscle that's healthy needs to be able to fully contract, relax, and overstretch. And that's what it's going to do in order to absorb all the shocks and be a real supporter for your body, for your back, for your hips, you name it. But if there is scar tissue blocking those muscles in that fascia, then it can't do its job. So we have to get that scar moving. True healing of that C-section scar looks like breaking up the scar itself. So when you look at the scar on your belly, you want this scar on your belly to not just move up and down or move side to side. We want the scar on the belly to be able to move in all directions and then be able to be picked up and moved away from the body. The other thing is, that's just the skin scar. We want the scar on all the layers, all 7 layers of the body to be able to move and go back and forth and be picked up as a whole. And we don't want to feel like we can trace scar all the way to the side of the body. And when that happens, we need to get everything moving. We need to get that scar completely dissolved. So we do that with manual therapy. We do that with regenerative therapies here at my clinic in Edmonds, Washington. And I have a clinic in Poulsbo, Washington. And that's what we specialize in. We specialize in getting these scars completely dissolved so that your core can actually function for you. And then it also helps so it breaks up the scars that have created deep connections, maybe to your colon, maybe to your low back, and we dissolve the scars on all the layers so that that scar tissue doesn't wreak havoc on your body anymore, and so that you can use your core and function without issues and without wearing out your joints. So once you get that scar tissue healed, then we got to work on the organs. We got to make sure the organs are moving in your body and ebbing and flowing. And when they're moving in your body, then things are working like your digestive system. Then things are working like menstruation, because the organ of the uterus has to be able to contract to slough the lining. But with the scar through the uterus, what happens is that scar gets denser and tighter over time. So as we progress through our midlife, that uterus, when it goes to slough the lining, the endometrial lining every single month, that uterus contracts down. Well, if there's a scar in that uterus and it hasn't been moved and doesn't move much, that impacts how well that uterus can contract. So when the uterus gets signals from prostaglandin to go ahead and go menstruate, what happens is that we'll get it either we won't respond to that signal, or we'll respond and we have to work so hard that that uterus is just cramping and working to slough that lining that it becomes excruciatingly painful, or that we get really heavy bleeding. So then a lot of doctors are going to prescribe things like a uterine ablation to help prevent you from menstruating, or some people might go as far as recommending a hysterectomy after this. Well, that's going to lay down even more scar tissue, and then here we go, our core is back to square one, and we got to do some regenerative techniques to then get rid of that scar tissue again, and then start retraining the core again. And so once we get rid of the scar tissue initially from that C-section, and we get the organs to start moving normally in the body again, menstruation should be completely pain-free, ovulation should be pain-free, and you should have no bloating and or constipation or diarrhea. And that should be, that's all because we get the organs moving well inside the abdominal cavity. Once we accomplish that, then we have to retrain the core. We have to retrain the pelvic floor, the abdominal wall, the butt, the low back, the lower traps, the lats. Once we get all of that retrained, then we have a really good shot at having a healthy, strong core. There also might be areas where we have to break things up and patterns up, so we're not, bearing more weight on our right leg than our left leg, and putting more stress through the right hip than the left hip. But once we get that core functioning and we get the body as balanced as we can, then what we do is we have a healthy core that can absorb forces as we go through our lives, whether that's working out, whether that's walking or jogging, or doing plyometrics or going to CrossFit, okay? It doesn't really matter. All that matters is we get our core back to a healthy level of function, and that will help take the pressure off the knees, take pressure off the hips, take pressure off the low back, reduce the chance of having sciatica. Now, are all of those issues still a possibility? Yes, it really depends on how long your body has had these compensations for. So of course, the sooner the better. But it doesn't matter. If you are 20 years after the C-section scar and you have severe sciatica, you are probably doing anything possible to get that sciatica gone. You maybe have already had spinal injections. Maybe you're thinking about getting PRP. But if we get to the root cause of that sciatica and we realize, oh, your core is not working, your spine's starting to twist a little bit, or you have more tension on this side of your spine than the other, and oh, that's going back to the scar that you have and all of this tissue issue in your belly, then we need to address that so that your core can function and that your body can restore its balance, taking the pressure off that sciatic nerve. So what can you do now? Well, number one, start rubbing your scar. Get your scar to move. Get familiar with your belly. The other thing you can do is work with a pelvic expert physical therapist, someone who can really evaluate all your scar tissue, evaluate the patterns that your body has developed, and then also look at your pelvic floor and see how your pelvic floor was affected from the abdominal surgeries, and then start to release all that tissue, get that tissue healthy again, so it reduces the stress on your low back and your hip and your knee. And once that tissue gets healthy, then you can start retraining the core. If you've had a C-section, like and subscribe to our content in our channel, and we put out a ton of information on how to exactly start to heal your scar, what to do if you're healing new scars or versus old scars. We'll link some of those videos to this video so you can see what to do and how exactly to start healing your scar today to help break up lifelong compensations that can lead to extremely heavy periods, sciatica, hip replacements, and knee replacements. We want you to live a happy, fulfilled life. So hopefully you got a little bit of information from this video. I'm Dr. Allison Feldt, owner of Body Motion Physical Therapy, located in Poulsbo and Edmonds, Washington. If you have specific questions about getting your scar to move, or your birth story, or what you're experiencing, whether that's sciatica, hip pain, or knee pain, please drop them in the chat below and we will get you answers. Take care.